Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey. Insights that matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lillie Shockney.
Hi, this is Lillie Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Healthy Insights That Matter. Today, I am sitting down with otolaryngologist and clinical director of otolaryngology, head and neck surgery at the Johns Hopkins Health Care and Surgery Center at Green Springs Station, Dr. Nicholas Rowan. And we're going to be talking together about a topic that maybe you've never thought about. What our topic today is going to be is smell loss, whether that be partial or complete loss of the sense of smell. So welcome, Dr. Rowan. I'm really glad to have you with me today.
Hey, thanks for having me. I'm excited to talk.
So COVID probably was our first opening into the understanding that certain diseases and disorders actually could end up with a side effect of losing our ability to smell, whether that be for a little while or for a much longer while. I remember personally when I had COVID, I lost my sense of smell. It made me feel very nervous. I didn't realize how dependent I was on it and how much I enjoyed it until I didn't have it. So it's like the old saying, you know the worth of water when the well is dry. And I understand this is already a study of research as to why we might lose our sense of smell, whether that be partially or completely, and for how long. So before we get into this, I think, quite fascinating topic, can you explain the anatomy of our noses and how it relates to our ability to smell?
Wow, a lot to unpack there. There's so many little great nuggets of information you just gave to me. And so I think just starting high level, sense of smell is something super important to me, both personally from an individual standpoint, and also from a professional standpoint, and really to most of us. And as you said, Lillie, really most of us don't even know how much we use it and we enjoy the sense of smell until we lose it or there's some sort of problem with it, which drives home the critical basic functionality that the sense of smell gives us as humans. And so as a bit of a primer, like you're asking, how does the nose work and how does the sense of smell work? Well, the sense of smell is something that occurs through a nerve that lives in our nose. It lives really high and deep up in the nasal cavity. So it's not in the front of your nose. You can't pick your nose and you can't touch it, but it's in there, up close to your brain. It's thought to be evolutionarily ancient. So as animals and organisms evolved, the sense of smell was the only thing we had. It was something that occurred well before vision, something that happened before sight. It was a way that you could track things chemically. So you could be attracted to things that were really necessary to help you live. Just like a dog kind of puts their nose to the ground looking for something and searching for food. That's what we all did on an organismal level throughout evolution. And so the sense of smell is actually the only nerve in the body that goes from the end organ, which is the nose in this case, directly to the brain. It doesn't have any relay station. It goes straight up to your noggin. Everything else, your eyes, the sense of touch, any reflex, goes somewhere else. And then the signal either goes up to your spine, goes up to your brain. It's really pretty cool in its anatomy. It has a couple of features that I think are worth talking about as we dive into this discussion. And the first is that the sense of smell, it's a pretty basic functionality, as you might imagine. If you spray a scent or an odor or a perfume or anything into the air, those little molecules, those little chemicals come in through the air, they go up through your nose, they bind to the receptors, and that electrical signal gets shot up to your brain and it says, okay, I'm smelling this. I have coffee. Here's a rose. This is garbage. This is mom's turkey on Thanksgiving, etc. And the sense of smell also occurs, interestingly, it also occurs not only from the front of the nose, what we breathe in, but through our mouths. So when you're chewing on food, what happens is as you compress the food in between your teeth and you move around in your mouth, the scents and the odors go up to the back of your nose, up into your nose, and you also smell your food while you're eating it. And that's known as retronasal olfaction. The really important part about that, that's really interesting, is about 90% of what we describe oftentimes as taste is actually flavor. So our noses are responsible for almost everything we eat. So the reason you get nervous with your COVID infection, not only do you not perceive the world around you, but also people who have long-term smell loss, we'll get into this in a moment, but they're depressed because they can't enjoy food. And we all love eating. It's a basic human functionality. We don't even talk about breathing first. We talk about eating, drinking. It's so important to us. So the interaction of smell with food is really, really important. So I think it's a good place to get started with an overview of how the anatomy works. And then I guess one little last nugget that I'll tell you about the smell nerve that's really super cool, and we'll come back to later when we're talking about how to fix this sense of smell, is that the sense of smell, the nerve that allows the sense of smell to happen, is unique in its regenerative capacity. So it is also one of the only nerves that can regenerate on its own spontaneously. So I know that the audience can't see me right now, but I'm wearing glasses on my face. I'd love to get rid of these things, but I'm stuck with them forever. I can have some sort of surgery, but my eyes are only going to get worse over time as I get older, probably playing the odds. I can't squint over and over again or read over and over again. I look at something over and over again, make my eyes stronger. The sense of smell, though, there's actually a decent body of evidence that says that you can practice the sense of smell and you can make it stronger. You can make it better. So it's much like curling a 3-pound weight. 3 pounds is very easy to lift, and your bicep can lift that weight very easily. You're not going to be buff like Arnold Schwarzenegger if you curl a 3-pound weight. But if you do that 3-pound weight 100 times, 1,000 times, 1,000,000 times, you're going to get some good tone. You're going to get stronger. And the sense of smell actually is unique in that no other sensory function in the body is able to do that. So you can't make your hearing better, can't make your eyes better, can't make your sense of touch better, you can't make your sense of taste better. It has some really, really cool individual features to it that we hope to investigate from a research standpoint, as you were mentioning.
Does the size of your nose help you smell better or stronger?
Some of my patients think that's true. They come in and say, look at this, doc, how come it doesn't work better because it's so large? The short answer, the size itself doesn't necessarily matter too much. The anatomy may matter. In some instances, we know that in some cases, the way that the nose is shaped on the inside can affect it. But certainly, really importantly, is if there's other stuff in the nose that you don't want there, like nasal polyps, for instance, or God forbid, a tumor or something like that, that things that influence the airflow up to where the smell nerve lives, those things will dramatically change the sense of smell. So if, for instance, you had a cold that's not COVID, you just get a stuffy nose for whatever reason, you can't smell anything. We all say we can't smell and taste when we get a cold because our nose is affected. So if the nose is narrowed and there's not really a whole bunch of airflow up to that cleft where that nerve lives, it's very challenging to interpret odors.
Fascinating. Tell us more about why is the ability to smell so important? You talked about back in the caveman age or ahead of that, the importance of smell. We certainly do know that animals rely on smell to find what they might want to eat later or eat at that moment. Can you describe why you see it as so important? Because I bet you if I asked you what is the most important sense that we have, I have the feeling smell might be number one.
I'm pretty biased. That should be a disclosure for this conversation that I'm super smell biased. And I actually give that disclosure in my talks. I don't know. I really like vision though. I like seeing. It's really nice. I wouldn't want to lose my sight. Back to the question you asked me about why it's important, what it's used for, and what's some of the underlying importance in our daily lives and our lifespan even, is on a daily level, the sense of smell is vital to the perception and experience of how we interact with the world. So things like food, like I mentioned, drink, pleasant scents, the smell of a loved one, the smell of our children, for instance. It's really important for bad scents, like to be socially aware, things like body odor, or if you have some rotting food, spoiled food, if you have toxic fumes, if there's a gas leak, if there's a fire, inherent danger things. If your child, for instance, that has a dirty diaper, things you want to know about. And so it helps us detect warning signs or negative indicators of things that might be around us. It's really important in that regard. All of these things tie into many, many quality of life related issues. So things, again, as I keep on harping on to begin this conversation, but eating and nutrition. So if you lose your sense of smell, you can have changes in your diet, what you take into your mouth and into your body for nutrition. You may change the type of things that you eat in not a good way because you're trying to get more or you're trying to get something else. I was so happy the thing you said up front about being nervous. It can lead to depression and anxiety when there's high quality data. And I see these patients on a weekly basis about individuals losing their sense of smell, and it is antecedent. So we know that it's something that happens in advance of people getting depression and anxiety. We know that it's associated with our cognitive function. And that can be because of the things I just mentioned, because it's wearing on you and it's disruptive to you. But also there's this remarkable association between the sense of smell and your neurocognitive function. So neurodegenerative disease is super important. Things like Alzheimer's, Parkinson's, as we all get older, as we all live longer, the prevalence of neurodegenerative diseases like dementia, for instance, are only increasing and increasing dramatically. And oftentimes, one of the very first symptoms of any of these neurodegenerative diseases is loss of sense of smell. I'll make the pitch to you at some point during this conversation, but no pun intended here, it would be a no-brainer to actually start assessing human sense of smell because it's something that we don't know, we don't measure frequently, and humans, we're not really super reliable individuals. You say, how's your sense of smell? You say, oh, it's good. But we all know some of the broad outcomes. We know that females are generally better than males. Males, we're stinky individuals and we don't let things bother us. But females always, there's actually objective evidence to this, and it's strong evidence. We know that women can smell better than men. It's not something that we can really put our finger on and say how good we are. It's just like your blood pressure. If you've got a raging headache, you can probably tell that it's high. If you're anxious, if your heart's beating out of your chest, you probably know that it's high. Otherwise, you don't know where it is anywhere on that scale. You need to put some numbers on it. And so there's ways to do that with a sense of smell that we just don't use in daily medicine at all nowadays. If you come see me, we'll measure it in the clinic, but even that is kind of limited and most of the time just done for research purposes.
Could you give us a laundry list of what causes smell loss? We talked about having a cold, which I'm sure all of our listeners have had many times and can relate to. And say, oh, yeah, where my nose is all plugged up, I can't smell anything. And you've talked about Alzheimer's and dementia.
Yep. So all of those things, colds, dementia, all kinds of neurodegenerative diseases, bang your head really hard if you have a traumatic brain injury. Probably one of the reasons why it goes away so easily sometimes is because it's not the most robust nerve. It's a pretty small nerve. They're tiny little fibers and they have an interface between your nose and your sinuses and your brain. If you whack your head hard enough, you can kind of shear off those nerves, which can be really problematic. The most common cause of smell loss that we haven't talked about actually is aging, though. The sense of smell invariably decreases over the course of human lifespan. So as you get older, the sense of smell decreases, so much so that about 40% of persons greater than the age of 65 years have some sort of objective smell loss, a discernible loss. Over 2/3 of people over the age of about 75 or 80 have pretty severe smell loss. We don't know exactly why that happens. We do know that some of the nerve fibers shrivel up, like many things that unfortunately happen as we all get older, but the density of those receptors in our nose also decrease over time. Other things that might cause smell loss are things like nasal polyps, chronic sinus infections, people like me who do sinus surgery, if you have an injury to that area, whether it's purposeful or not purposeful, all those types of things, and many other things. There are plenty of diseases that we have throughout our bodies that cause inflammation that can all be associated with smell loss. But I'd say that sinus conditions, viral infections, things like COVID, which have been around forever. We haven't ever been in a situation in our lifetimes where everybody gets sick with the same infection that causes smell loss. And then aging, again, is overwhelmingly one of the most prevalent causes of olfactory dysfunction or smell loss.
That's interesting that it's tied to aging, because I think about the fact that as we get older and get into the area of what I would call elderly, our noses get bigger and our ears get bigger. So I was hoping maybe over time our smelling sense would even be sharper because it's got bigger nostrils to go up in there and find that smell nerve. But I guess that is not correct.
Unfortunately not. We have some research trying to figure out how to stave off the factory loss associated with aging, but the natural history is that it does diminish over time.
My specialty is breast cancer. That's my practice. And in particular, metastatic breast cancer patients. And one of the things that I have learned over many decades and have talked to families about this is that as a patient begins to be actively dying over a number of days, not weeks, but actually days, the patient will say, I'm not hungry. Everything tastes like paper. They also, if you ask them, will say, I don't think I can smell anything either. And it doesn't matter what kind of cancer it is, this association of everything tastes like paper. So I don't know if that's ever been studied, but I'll throw it out there as something to consider because I do find it fascinating. It's an immediate warning sign to the family that we're looking at just a few days, if not even a few hours, for that person to still be with us.
So I can postulate as to what the relationship is in the last few days of life. But let me throw this other little factoid at you. That was one of the reasons why I got so interested in the sense of smell and why I think it's so important. The sense of smell, and smell loss in particular, is probably the single strongest predictor of your overall mortality than anything else. So when we talk about things that are bad for us, like heart failure, lung disease, cancer, cardiovascular disease, our cognitive function. We all know those things are bad for us, being overweight, having diabetes, etc. When you take all of the things that could possibly be bad for you, all the risk factors, your mortality, and you throw them into an algorithm that looks at what's the biggest risk factor, and you start correcting for all these things. You say, okay, I'm going to compare people who are overweight to people who are a normal body weight, people who have diabetes, people who don't have diabetes. One of the single strongest and the last predictor that remains standing on that competitive battle of what's the worst thing for you is your sense of smell. And it's actually predictive of your overall mortality. And that's essentially where my entire body of research lives, trying to figure out why that relationship exists. Is it an indicator of our resilience, of our robustness? And it certainly seems like it is. And so I work in the frailty space very often. We've looked at sense of smell in our cancer patients and correlated with patient outcomes. We're actively doing that right now to see if it is an indicator of how well you're likely to do and if there's any way we can intervene to help you do better or at least understand the situation better. There's some really exciting emerging data in this area. We're actively looking at it.
That's wonderful to hear that that's part of the research going on right now. I also think about educating family members is so important too, so that they're observing and reporting what they're seeing in the comments that their loved one may be making. I've always believed that our brain figures out you don't need to eat anymore. It doesn't have a purpose. And if it doesn't have a purpose because you are actively dying, then you really don't feel interested in eating paper. That's the classic thing that they will say is that everything tastes like paper. And I'm
Super
like,
interesting.
wow, yeah, it truly is. So if someone is experiencing smell loss, will they recognize that right away, or are there signs and symptoms that would inform us and inform you as their doctor, this person is experiencing progressive smell loss?
It really depends on how the smell loss occurs. Like I said, we are not actually good predictors of our overall sensory function. So we have some really funny studies where we ask people to rate their sense of smell. In a recent study that we just did in our cancer patients, actually, we asked them to rate their sense of smell. We said, on a scale of 1 to 10, 10 being the best, how good is your smell? The average score across the entire population was 9 out of 10. They all said that they're pretty good. Well, when we did actual smell tests on them, we presented them with an odor and we asked them to identify it. About 2/3 of them had moderate or worse smell loss. And so you can't predict when it happened. There is a caveat to that. If you lose your sense of smell suddenly, if you become like nose blind, for instance, like you have COVID and all of a sudden your smell receptors aren't working at all and it's kaput, we're pretty good at saying that. We're saying, oh, whoa, something happened. So in COVID, we didn't have testing available for months and months. And like the first year is still hard. You could detect by symptoms. The strongest predictor of actual COVID infection was smell loss, because that's really pretty unique to COVID. So it depends. Sometimes clinically speaking, sometimes not the patient, it's their partner. It's one of their family members that's saying, hey, Nick, he smells really bad. He's not aware of it. His fridge is full of rotten eggs and he's not doing anything about it. Something contextually like that. Sometimes it's the other people who are aware. But again, many times we're not aware of it, which is one of my big reasons why I think that smell testing is so important. We do visual tests, we do hearing tests. We don't do smell tests. Just like your hearing loss, you know, when you see the TV going all the way up to max, you probably get the insight eventually that your hearing has been diminishing over time. You didn't catch it when your TV goes up to a top of 50, and maybe when it was at 30, you didn't realize that it was too loud. But in the same way, when your sense of smell doesn't work at all, you recognize it. But the in between, from mild, moderate to severe, it's really hard to detect.
Wow, that's fascinating. Share with me, how do you go about measuring loss of smell? Do you have a
Well, there's
smellometer? Of
yeah,
course, I'm curious to know if anybody will ever develop a smell-o-vision television.
it's
So I
like
think if they
Willy
do,
Wonka. You can taste the
they'll
wallpaper.
sell a lot more products, on TV commercials. If you can smell something and you say, "Wow, that does smell good," I think I'll order that.
I think that the integration of smell into our daily lives, into consumerism, is at the forefront. And that's something we're only going to see develop even more and more. Back to your question of things like how do you do the actual smell test? Well, there's a bunch of different ways. Again, asking people is not a very reliable way. So we usually do it, but just don't put too much weight in it. But when we're doing it in the office, well, we do it in one of two different ways, most practically done. One, we can give a scratch and sniff book, and there are designed booklets that have normative data, meaning they've been compared against thousands, in some cases, tens and hundreds of thousands of patients. So we know age and sex norms. For our research studies, we do a Cadillac of smell testing. We have a 48 item scented marker kit where we look at all the different aspects of olfaction, all kinds of different odors. And we have a tester sitting there presenting the odors to patients. And so you can put a number on it. That's not really super conducive to be in clinical practice. It takes at least a solid half an hour to do it. It requires a body to do it. It's not reimbursed by insurance, so you can't get paid for using that person's time or the expensive kit you have to do. So we most oftentimes say are for research purposes, but scratch and sniff booklets are pretty darn convenient and they can be done pretty quickly. And we do that in the office.
Wow. I wanted to share a couple of stories of my own with you that are related to smell. One is I had a patient who had been taking care of her husband who had advanced pancreatic cancer. Now, oftentimes someone with stage 4 pancreatic cancer on average will only survive 5 months. This gentleman had lived for 6 years, which was quite phenomenal, but she was his primary caregiver. And during that time, she ignored her own health. So she wasn't getting any screening done of any kind. She wasn't going outside and power walking. She was at his side all the time, all the time, all the time. He passed away, and it was after his burial, she then came in to get a mammogram and told us, "I've had this lump in my breast right before my husband got diagnosed. I'm pretty sure it's cancer. It's gotten bigger and harder. I want to know, is this something I could survive or should I just do nothing?" She was 52. So, of course, I said, well, we aren't going to do nothing. Nothing doesn't sound like a good plan. And the tumor was one that was going to be a stage 2, which we certainly do still consider stage 1 and 2 early diagnoses. The evening before her surgery, she called me at home around 9 p.m. and she said, I wanted to let you know so you can tell whoever needs to know, I won't be coming in tomorrow for my surgery. I think that I want to be with my husband. And I said, oh, we don't know that your husband wants you to be with him right now. I think he's in heaven trying to be your angel right now. And she said, I just miss him so badly. I can't describe to you how much I miss him. So I said, what are things that are in the smell category that make you remember him the most? Because smell and memory are so tied together, right? And she said he planted a rose garden and took care of it constantly and would always clip a bouquet of roses and put them in the vase in our kitchen table. So whenever I smell roses, I think about him. And I said, well, it's summertime. The roses are growing out there. Yes. And I said, where is he buried? And she said, well, don't tell anybody, but he was cremated and asked to be sprinkled in the rose garden. Oh, so he's out there with the roses. Yes. I said, all right, here is the game plan that we're going to do right now while I'm on the phone with you. You're going to get your clippers, go out into the rose garden and cut some roses off, come in the house, get out a big pot that's pretty deep, put maybe 2 inches of water in it, take those roses and mush them up so it's all of the rose petals so you can really smell them very strongly. Get a towel, put it over your head, turn that pot on so the steam comes up, and you can smell not just the roses, but you also know your husband is with you. And so she did that, and she did show up at 7 a.m. the next morning. And I said, I'm just so relieved to see you. And she said, I can still smell him. And I thought, oh, thank goodness. I was really relieved that she had called me. Otherwise, it just would have been a no-show, and it would have been a lot of cajoling to try to get her to come back in and do the right thing. I'm a big Yankee Candle fan. I have specific candles for specific seasons, and certain ones will even trigger my memory for certain family members that I've lost. And I'll sit there and just smell it. If I'm feeling down, I will go to a Yankee Candle store and go around and take the lids off so I can smell certain scents that I desire to smell at that time. I've also been known to hold a candle and go over to a total stranger and say, oh, smell this. And of course they won't, because they don't know me and they don't even know what scent I'm asking them to smell, which isn't very good, I guess. The other story I wanted to tell you is with a little boy who was 8 years old. It was the weekend of Thanksgiving. It was a Friday, the day after Thanksgiving, and there was always this Victorian house that was empty all the rest of the year, but in the spring, they'd have this huge craft show in it, and then the weekend of Thanksgiving, they had a big Christmas show in it, 3 stories, so homemade crafts in every single room, just fabulous, fabulous things. And I noticed while I was doing my shopping in there, I noticed this little boy who I didn't see he was with anybody. So I thought, well, maybe his mom's in the other room. And he said, I want to come over here and just look around. But I couldn't imagine an 8-year-old boy being excited about looking at Christmas crafts. But he would go over and he would pick up something and look at it and he'd smell it. And then he'd shake his head no, and he'd put it back down. As I went from room to room, I noticed that I'd see him again in the next room. Still wasn't seeing his mother anywhere. One of the rooms was just for infants and toddler things, beautiful baby blankets and just lovely, lovely things. I was in there in that space. He came in and he went, oh, and he's looking all around, and he went over to this little box. It was wooden. The top of it was pink satin fabric that had been puffed up by having, I think, cotton in it. He picked it up. He didn't open the box. He just picked it up and he smelled it and he went, this is it. And he left the room. So I'm now downstairs in line and I see he's also in line 3 people ahead of me. And he got up there to the counter to a clerk who obviously did not want to work that day. She looked at him and she said, that'll be $21.50. And he went, no, it says it's $20 and I have $20. She said, you're forgetting about tax and something else, and it's $21.50. So if you don't have the money, you have to go put it back. He started crying. So the enabler that I am, I get out of my line and I go up to him. And I said, sweetheart, tell me what's going on here. And he took the box and he said, smell this. And I smelled it. It smelled like baby powder. And he said, my mommy is really sad. I had a baby sister born 3 weeks ago and she's passed away. So I thought if I could come here and find something that smells like my baby sister, I could make my mommy feel better. Well, I'm crying. That clerk was not crying. I was ready to have her removed. And I said, how much more money do you need? And the clerk said, he's short $1.50. So I took out $1.50 and I gave it to her. She says, well, it's a good thing your mom is here with you. And he says, she's not my mom. She's just a really nice lady. And he threw his arms around my hips and hugged me. And he said, thank you so much, lady, and got his package and went on out. And I thought, how remarkable that this little boy figured out that if he could do something that could help his mom feel better by still feeling like she's holding his baby sister, he could make her smile again. And so I wrote an article about it. It's the very first time I'd ever written an article that was non-medical. It ended up on the Christmas Day Baltimore Sun front page called A Gift for Mother. I still think about that little boy. I mean, he would now be in his late 20s. And I just wonder what was his career path, because he was such a compassionate child. But it struck me so that he was on a mission. I knew that he was going to fulfill it. Now, I don't know if smelling that baby powder made her feel better, but I did end my article in saying, though you've lost your newborn, you have an extraordinary son who is the most compassionate and caring person I believe I've ever met. And that he had gone there by himself. I don't even know where he lived, but he went there all by himself, and he did that for her. So that was pretty fantastic. So we certainly do find that if we smell something, it will trigger memory, good memory or bad memory, right? Just flip-flops both the same ways. And I learned unpleasantly when I did have COVID, and it was in the fall, and I was putting out my fall decorations, and I had my Yankee candles, and I took off the lid, and I've got the one that's called Harvest and the one that's called Spice Pumpkin, and I couldn't smell them at all. And I cried because that was such a key part. It wasn't enough for me to just look at all of the decorations and the glass blown pumpkins I had and the scarecrow and all that. I wanted to smell the season, and I totally missed that season. Thank heavens my smell came back before Christmas. I don't know what I would have done. That would have been really bad for me. Really bad.
Lillie, you asked me before about if I thought that the sense of smell was the most important, but I'm beginning to think that for you, the sense of smell may be the most important.
It is awfully important, and it's important to my patients, and I talk to them about that. If you can share a memory with a loved one, how can we grab that memory and talk about it through having something that smells and triggers your memory for that? I certainly do. That's incredibly important.
Those are two super powerful stories, really, really powerful. And I mean, it goes back to what I said in the beginning. Sense of smell is very unique in that it doesn't have a relay center. Just goes straight to your brain. And it goes to really two places, globally speaking. One, it goes to your hippocampus, which is where memories are formed. And so we know that smell is intimately associated with memory. The other place it goes to a bunch of places associated with the limbic system. Limbic system is emotion. So memory and emotion, and they go hand in hand. And so stories like yours are so really at the core of our being. I mentioned Thanksgiving turkey, or like a Christmas turkey, or some sort of holiday meal. And the really fun part about this is we all know this as humans. We think about the smells that we enjoy and we love. When you study it and you look at it, turkey, for instance, I like picking on turkey because I don't really like turkey that much. It's kind of a bland meat. It's better with a bunch of sauce on it. But it's the smell of the turkey that's cooking when mom has it in the oven. It's the meal that's in the oven that we get excited about, that we have that memory. It's not so much actually eating the food. Some of us have wonderful chefs in the home and cooks in the home, and you say, yeah, that meal was amazing. But really, it's the preparation that goes into it, the scents that are around you. And that's the intimate association between our well-being and our quality of life and the sense of smell. It's pretty remarkable.
If someone that's listening to us today is thinking about, gee, I think I might be losing or having a diminished sense of smell, what should they do if they realize that is declining? Is there a way to boost it back up?
I think of this in a few different ways. And number one is that oftentimes when we lose our sense of smell, it is because of a cold, because we have a stuffy nose, we have something going on with our nose. A lot of times a tincture of time, just allowing things to get better, just like it probably did. I haven't asked you, but what did you do for your COVID infection? It probably just resolved on its own. It's something that got better with time.
10 weeks.
Yeah.
10 weeks, and then it came back.
COVID is special. It takes a while. And some patients who have really substantial viral loss can take upwards of over a year to improve. It'll take a couple of years to improve. But if it is something that you lose just to the smell, you noticed it, it stays down, it stays diminished. First and foremost, always discussing these things in the context of seeing a primary care physician is always really important. There may be other warning signs that something else is going on. May not be, it might be an isolated smell issue. And then they can, if warranted, refer to somebody like myself, who's an otolaryngologist, ear, nose, and throat physician. What we do commonly is we evaluate patients. We ask them about their sense of smell. In some situations, we do in the office, we test it. Again, it's not super routine. That's a problem with the U.S. healthcare system. Maybe we'll have another podcast some other time about healthcare reform and doing things that are important. And I think that smell testing is something that we should have access to. It's very easy. I'm telling you about scratch and sniff cards, it's not super rigorous, but if we can do smell testing, we'll do smell testing. We'll look in the nose. Oftentimes what I do, my physical exam is really pretty unique. I take a little camera and I put it in your nose to kind of evaluate what's going on. It's a super routine, very common, easy test. Takes all about 20 seconds for me to do a comprehensive exam of the nasal cavity. I can quickly rule out any issues with things like nasal polyps, any sinus infections, any masses, things that you would want to know about. That's really, really important. And then if somebody does have smell loss, I think you started asking, what do you do for it? How do you boost it? Getting into the idea of treatments, the troubling part about smell is that the treatments are not super rigorous. There are ongoing studies. There are pills that you can take by mouth. There are injections they can give in the nose, all to try to help to boost the sense of smell. Many of them are not supported by a super rigorous body of evidence that says, yes, you should do this. The highest level evidence that we have, actually, the number one thing that we suggest people do is what's known as smell training. And I referred to this before about smelling things over and over again. You were asking me before we started recording this conversation if I have a smellometer in my office here. And sure enough, this little smellometer that we designed, this is a way to do smell training. And there's little vials in this smell wheel. We've got an app that goes along with it, and it tells you which vial to pick out. You pull it up next to your nose and you smell it. And you practice smelling a strong odor for all about 10, 20 seconds per odor. The classic way of doing this is you have 4 odors. You smell them for 20 seconds each. You spend a whole total of 2 minutes smelling things. You do it morning and night, twice a day. Do it for the order of about 3 months. That's shown to be associated with improved sense of smell. Now, it's not something you become a wine sommelier, your sense of smell becomes amazing. But in many cases, there are clinically meaningful improvements in the sense of smell, which is what's important. Getting you up from not functioning to functioning, and at least you have something, or moderate functioning to kind of normal levels. And so smell training is really something that we do recommend quite frequently. There are many lovely websites. If I would give a plug, there's some nonprofit organizations, mostly in the UK. There's one called Absent, for instance. It's a little play on words, but ABSCENT, .org. And they have a lovely set of resources for individuals with smell loss. They have different communities, virtual communities for people with all the cutting edge evidence, and support groups for people who lose their sense of smell, because it can be devastating. Again, for many patients, they do just fine with smell loss or reduced sense of smell. My sense of smell is probably less than yours, Lillie, because I'm a dude. Our noses don't work as well. And that's fine for me. It might not be fine for you, though. It's really important to cater to the individual. I oftentimes recommend that people seek out advice in those types of forums. It's very helpful.
How did you go about selecting what the 4 smells would be for the smell training?
I didn't do it at all. I like speaking about evidence. I'll tell you what, I don't know there's a ton of evidence behind what to smell. Some person...
I'm just curious.
Yeah. So they try to make it varied, be intuitive. You don't want to smell lemon, lime, orange, and tangerine because those are probably all the same. Maybe you want to smell, the 4 classic ones are clove, eucalyptus, rose, and lemon, 4 disparate type scents. And so I think it's important to maybe, if you're thinking about like doing a bicep curl, you got a 3-pound weight, you're going forwards, you're curling up towards your bicep, maybe you're pulling backwards towards your back, working all the different muscles slowly but surely.
I like that. When a baby is born, can they smell right away? They can't tell us that they can smell, but
yeah, it's hard to test. You can't put it in front of them and be like, hey, is this lemon? They can't communicate with you. But we know that certainly it is incredibly functional. They can smell their moms. There are many super interesting studies from a behavioral type pattern to show that the sense of smell does work. You can actually test younger children as well. Testing is a bit more rigorous. It's hard to put some of the finer numbers on it. But the yes, no type of question, you can absolutely assess it. And we do know that it's functional in neonates, toddlers, and little ones who maybe don't cooperate as well as you and I might on that Cadillac of testing, as I discussed before.
Wow, isn't that fascinating? And I know there are some animals that can smell something miles away, which is, I just think that's extraordinary. Absolutely extraordinary. Wow. Are there any other pearls of wisdom you would like to share with our audience today?
Awareness about the sense of smell is just what's super important. I haven't driven that home enough. It's something that's really critical to human well-being. There's things about our health span and our lifespan, the quality of life that we live, and even the overall trajectory and how long it is. And so being cognizant of it, if you lose your sense of smell, you're not crazy, it's bothering you, seek out help. It's something that's really important to us and it affects us all. Don't overlook it. Maybe in years to come, we can convince the important people that matter that testing for smell loss and doing interventions to make it better when people do lose it is really important because many of us have it. As I mentioned, aging older adults, upwards of 2/3 of people in their 8th decade of life have a severe loss. And we're all getting older. Many of us, if you're playing the odds, we're all going to have substantial smell loss. Just like you said, you don't want to lose just a smell, and I don't want to lose mine either. I'd love for there to be opportunities to preserve that really special sensory function.
Yeah, absolutely. Absolutely. Well, I want to first thank you, Dr. Rowan, for joining us today. I think that our audience has truly been enlightened about something that I bet they rarely ever think about. Now, this will be on their mind, and I'm sure they've been listening to this and picking up objects around them and smelling them while you and I have been talking to assess for themselves how their smellometer, I'll call it, is actually working. We have many experts from Hopkins that join us each month to cover another topic. I think this one, I'm going to say, for me, is the most unusual topic that we've covered, but also one that is dynamic and has a big impact on the quality of our life. So thank you for becoming a smell doctor. And I'm curious to know, if you don't have a license plate that says smell doctor, I want to encourage you to get one because I think that will fit you absolutely perfectly. To all of our listeners today, I look forward to next month when we bring you another educational podcast from another Johns Hopkins medicine expert. And please take care of yourselves. We're starting the new year, hopefully starting it in a healthier way. 2025, we will bring you another set of 12 different topics for you to learn about. So again, Dr. Rowan, thank you so much for joining us today.
Thanks so much for having me. This is great.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lillie Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey acknowledges unrestricted educational support for our podcast, Healthy Insights That Matter from Astellas. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/awomansjourney. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/awomansjourney. Until next time, stay well.